My name is Amy Dahl. I'm the occupational therapist, and this is Cassie Sherlock. She's a physical therapist. So today we're going to discuss how to mobilize patients who have a total hip replacement or a total knee replacement. So we're going to discuss how getting in and out of bed, how to transfer to the commode after they have surgery day 0. All right, so now we're going to discuss how to get patients who have a total hip replacement in and out of bed into the commode day 0 of surgery. Typically, Dr. Cotwell does not do any hip precautions. If there are hip precautions, they will be documented, and he uses posterior hip precautions. So there's 3 motions you cannot do. If there are posterior hip precautions, the first one is you do not want to cross your legs, like Cassie. Second one is you do not want to flex or bend your hip more than 90 degrees. So that means bending down, touching your toes, or sitting in a really low chair. And lastly, no internal rotation of the hips, so bringing those toes inward. So now we're just going to practice how to get patient from supine to sit bed mobility. So we'll pretend today that Cassie had a hip replacement on her right hip. So first you'll just have the patient bring their good strong leg off the bed, so it's her left leg. And then you as the nurse, you're going to support the patient's leg. You're going to put one hand underneath the knee and one hand underneath the ankle. And then you may have to do it slowly depending on patient's pain, but you're just going to slowly guide the leg off the bed. And then you're going to have the patient kind of scoot their hips forward using their hands. And then you can continue to support it if you need it. Now they're sitting on the edge of the bed. So next we'll practice if the patient needed to go to the bathroom, practice getting on and off the commode. So you typically want to put the commode on the strong side. So since Cassie had the hip replacement on her right, you're going to put the commode to the left of her. And you're going to use a gait belt and a walker. So to start, you're going to put the gait belt around the patient, and you're going to just put it on her lower waist. And just make sure it's secured fairly tight. It'll just make it easier so you have a good grasp onto the patient if they need assistance. Okay. And then you'll use a walker, so you can adjust the height as you need to on the legs, but we don't need to today. And then you're just going to place the walker right in front of the patient. And then you are going to stand on the strong side of the patient to help with the transfer. And then the patient's going to put one hand on the walker, one hand on the bed. It does not matter which hand it is. And then you're going to just tell the patient to push up from the bed with the arm and stand up. And you're going to hold on to the gait belt to assist. Good. And then you're just now going to tell the patient to pivot so they can sit on the commode. So they'll start moving the walker, taking a couple steps. You'll still just hold on to the patient just in case they need some assistance, and tell them to back up to the commode until they feel the commode with the back of their legs. Cassie, do you feel the commode?
Yes.
Okay. Now you're going to have the patient reach back for an armrest with one arm. Yep. And they can always bring their operated leg out a little bit if they want to, and then lower yourself down. Perfect. Now, to stand up from the commode, it's kind of the same thing. You'll have them put one hand on the walker, one hand on the commode, and push straight up. Perfect. And then same thing, we'll have them sit back on the bed, just take some nice slow steps, and have them sit closer to the head of the bed. It's going to make it easier for them to lay back down. Yep. All right, and then make sure they can feel the bed with the back of their legs. If they do, have them reach back for the bed with one arm. Lower themselves down. All right, then you move the walker. Take off the gait belt. And now we're going to have the patient get back in bed. So you're going to help support the patient's operated leg again at the ankle, at the knee, and then you're going to get back in bed. They're going to do their upper body, so have them use their arms to help adjust, scoot their hips as needed, and you're going to just keep supporting the leg. And then you'll have them bring their other leg in. And they're high in the bed and they're back in bed. And that is how you mobilize a patient with a total hip replacement.
So now we're going to talk about how to mobilize a patient after they've had a total knee replacement. Dr. Cotwell has some protocols he likes to put in place. First off, when you get the patient from the operating room, they're going to come up with a pillow under their ankle. They do not want anything under the knee. So when you move patients, they should come up with the knee under the ankle. Another thing Dr. Cotwell likes is to make sure the knee does not bend on the bed. So you want to make sure you lock out the bed in the knee position. You want to make sure the knee is completely down and you lock it out. That way the patient will not be able to bend the lower portion of the bed. Okay. So now we're going to discuss how to mobilize a patient after they've had their total knee replacement. So first off, we're going to go from getting to the edge of the bed. So you'll remove the pillow from underneath the ankle by placing a hand under the knee and under the ankle to move the pillow. The patient will assist by moving their non-operative leg to the edge of the bed. To move their operated leg, you're going to put a hand under the knee and under the ankle and slowly move it to the edge. Once you get all the way to the edge, the patient will be able to assist with their upper body. It is okay for the patients to bend their knee to place their foot on the floor. Then when the patient has to go to use the commode, you use a gait belt and a walker to get them to standing. You will place the gait belt around their waist and make sure it is nice and tight to help you assist the patient to standing. Just like so. You will also use a walker to help them stand. You will place the commode on their non-operative side to make it easier. Once you get to the edge of the bed, you will have the patient put one hand on the bed and one hand on the walker to help stand. Once you are standing, the patient is able to step with the walker over to the commode. Once you get to the commode, the patient should feel both knees on the back of the commode, and then they can reach back, place a hand on the commode, and have a seat. When they are ready to stand from the commode, you will have them place one hand on the walker and one hand on the commode to help push themselves up. You will support them by using the gait belt, and they will be able to ambulate back to the edge of the bed. Once they get there, once they feel the bed on the back of their legs, they can reach back and have a seat. Once they're on the edge of the bed, you remove the gait belt and the walker. And then you also assist their leg back into bed. Under the knee and under the ankle, you will slowly move it back into bed. They will assist with their upper body and their other leg. Just like in the beginning, you will make sure to place the pillow back under their knee. Some patients will come up with varying weight-bearing status as of toe touch weight bearing and non-weight bearing. These patients are still able to get up post-op day 0. Just utilize the walker and the gait belt to help you assist them. If you have any further questions or concerns regarding weight-bearing status or transfers, you can contact any of the therapists in the rehab department, or Amy and I, we are here to help you.